Good afternoon and welcome to Downing Street for today's coronavirus press briefing. I'm joined by our National Medical Director for the NHS, Professor Steve Powis, and Professor of Public Health and Epidemiology at Manchester, Professor John Newton. Our step-by-step action plan is aiming to slow the spread of the virus so fewer people need hospital treatment at any one time, protecting the NHS's ability to cope. At each point, we've been following scientific and medical advice, and we've been deliberate in our actions, taking the right steps at the right time. We're also taking unprecedented action to increase NHS capacity by dramatically expanding the numbers of beds, of key staff, and life-saving equipment to the front line, to give people the care they need when they need it most. I've been away for a week now, and I'm delighted to be back. In the past week, we've completed the construction of a whole new hospital, the NHS Nightingale Hospital in London, built in 9 days. With 4,000 beds, this is the equivalent of 10 district general hospitals. And there's more to come in Birmingham, Manchester, and Glasgow, where the military have been working wonders in helping to construct. This has been an incredible achievement, and I want to thank everybody involved. I also want to thank everyone who has followed the social distancing guidelines and the admirable fortitude and spirit of the British people in following these rules. And Steve will update us on the progress that's being made and how people are following those rules. And I want to pay a huge tribute to all of the councils, the primary care, community care, pharmacies, and unbelievable 750,000 volunteers who've signed up for shielding the most vulnerable. This is Britain at its best. Sadly, the coronavirus continues to grow. I can report that through the government's ongoing monitoring and testing programme, that according to the latest figures, 163,194 people have now been tested for the virus. 33,718 have tested positive. And the best scientific analysis is that the rate of infection has been doubling every 3 to 4 days. The number of people admitted to hospital with coronavirus symptoms is now 12,949. Of those who've contracted the virus, 2,921 have sadly died. We express our deepest condolences to the families and to the friends of the victims. If the past few weeks have shown us anything, it's that we are steadfast as a country in our resolve to defeat this invisible killer. I'm profoundly moved by the compassion and the commitment that we're seeing from people right across the country. And in the health and care system, we've lost colleagues too. Doctors, nurses, mental health professionals, they have paid the ultimate price for their service, working to care for others. And I just want to say this on behalf of all my colleagues in health and social care. I am awed by the dedication of colleagues on the front line, every single person who contributes to the running of this diverse and caring institution that our nation holds so dear. Many of those who've died, who are from the NHS, were people who came to this country to make a difference, and they did, and they've given their lives in sacrifice, and we salute them. And I tell you this, I come back redoubled in my determination to fight this virus with everything I've got, and we will strain every sinew to defeat it once and for all. And I'll stop at nothing to make sure that frontline staff have the right equipment so that they're safe and can have the confidence they need to do their jobs. And I know that people have been asking questions about protective equipment. With the support of the British military, we've shipped a record quantity of equipment to the front line. Just yesterday, 45 million pieces of protective equipment were delivered across health and social care, including more than 5 million aprons and 6 million surgical masks. Today, Public Health England have announced the upgraded Ppe Standards that people should use and expect. The upgraded guidance has been developed through intense consultation with stakeholders right across the board and staff on the front line. We have listened, we've put the interests of health and care staff first and put them at the heart of this. The new guidance recommends the appropriate level of PPE to protect people in all circumstances. These standards are amongst the highest in the world and in line with the recommendations of the World Health Organization. I'm delighted they've been welcomed by the Medical Royal Colleges, the BMA, the Royal College of Nurses, and the trade unions. Any health or care organisation that needs PPE should call the hotline so that our military operation for delivering PPE can get that protective equipment to you. These are unprecedented times for our health and care system, and I want to make sure that every part of it is supported. I've therefore made £300 million available for funding for community pharmacies, who do so much to get vital medicines to people and play such an important part in their communities. They themselves are the NHS frontline. And today, to help NHS trusts to deliver what's needed without worrying about past finances, I can announce that I'm writing off £13.4 billion of historic NHS debt. This landmark step will not only put the NHS in a stronger position to be able to respond to this global coronavirus pandemic, but it will ensure that our NHS has stronger foundations for the future too. But this is only one part of the picture. I quite understand too why people are yearning for the certainty that good testing provides. I get it. Public Health England can be incredibly proud of the world-beating work they've done so far on testing. The rollout of Public Health England's COVID-19 diagnostic test is the fastest deployment of a novel test in recent history, including faster than the swine flu pandemic in 2009. But I'm going to level with you about the challenges that we face and the plan we have to rise to those challenges. I'm going to go through some of the challenges in very specific detail and then talk about the plan we have to drive this forward with a significant increase in testing. First of all, unlike some countries, we didn't go into this crisis with a huge diagnostics industry. We have the best scientific labs in the world, but we did not have the scale. My German counterpart, for instance, could call upon 100 test labs ready and waiting when the crisis struck, thanks in large part to Roche, one of the biggest diagnostic companies in the world. We have had to build from a lower base. Next, there's the demand for materials. There's been a shortage of both swabs and reagents. Thanks to the ingenuity of my team, we have fixed the swabs issue, and we're tackling the shortage of reagents. We're resolving this reagents issue, but as the head of Roche and the President of the United States have commented, this is a global challenge. I'm sure that we'll get there. Next, there's the challenge of prioritization. Look, I understand why NHS staff want tests so they can get back to the front line. Of course I do. But I took the decision that the first priority has to be the patients for whom the result of a test could be the difference in treatment that is the difference between life and death. I believe anybody in my shoes would have taken the same decision. I'm proud that every single patient who's needed a test for life-saving treatment has had access to a test. But of course, NHS staff need access to testing too. And I'm delighted that at the weekend we could roll out this access for the first time. And there's a challenge too of making sure that the public can have confidence in tests. Several of the tests that we're currently checking have failed. In one case, a test that I'm being urged to buy missed 3 out of 4 positive cases of coronavirus. That means in 3/4 of cases, that test would have given the false comfort of sending someone with coronavirus back on the wards. Approving tests that don't work is dangerous, and I will not do it. Now, these are some of the challenges that we've faced, but I want to set out my plan to boost testing. Let's first be clear about the goal. Always to ensure that testing is available to patients who need it. Next, to expand testing to critical NHS staff and their families. And I can announce today that we're expanding testing for NHS staff further. Third, as we ramp up the numbers, we'll test critical key workers, and over time, we'll expand testing to the community. Our ultimate goal is that anyone who needs a test should have one. Now, let me take a moment to set out my 5-pillar testing strategy to achieve these goals. The first pillar is swab testing in Public Health England labs and within the NHS in their hospitals. This is the testing to find out if you currently have the virus. We've already reached a target of 10,000 tests per day, precisely on time, by the end of March, as committed. And we're committed to reaching 25,000 tests per day by the end of April at the latest. Because it allows the NHS to identify and effectively care for those who are most seriously ill, saving lives by helping clinicians decide the most effective treatment options, I can reassure you that every single patient who needs a test is able to have one, and this is how we're going to make sure that people get the right treatment in hospitals. The second pillar is the creation of a brand new swab testing capacity delivered by commercial partners. Again, this is swab testing to tell if people have the virus. The biggest part of Pillar 2 is partnerships with universities, research institutes, and companies like Amazon and Boots to build from scratch a network of new labs and testing sites across the country. This brand new service has just launched and is ramping up rapidly. The trials of this have successfully completed, and the number of tests at this facility will significantly increase from this weekend. To begin with, this capacity will be used solely for frontline NHS staff and their families. Increasing testing capacity for NHS staff will allow more doctors and nurses who do not have the disease safely to go back to work and to treat those who are most in need of care. These are currently in the final stages of development. As of now, over 5,000 NHS workers have been tested across the 5 new testing sites and these testing capabilities. Currently, there are only 5.7% of doctors absent due to COVID-19, but of course we want to get that number down. And we're working with other testing companies to expand Pillar 2, so over time we have many different commercial partners delivering mass swab testing. The third pillar is blood tests. Now, blood tests are designed to tell whether people have had the virus and are now immune. These tests are done by taking a blood sample and looking for the presence of the right COVID-19 antibodies. These could potentially be done at home with a finger prick and deliver results in as little as 20 minutes. We're currently working with 9 companies who've offered these tests and evaluating their effectiveness. These antibody tests, blood tests, offer the hope that people who think they've had the disease will know they're immune and can get back to life as much as possible as normal. But they've got to work. The fourth pillar is surveillance. We're conducting some of the biggest surveys in the world to find out what proportion of the population already have the virus. This is done using an ultra-high accuracy antibody test operated by Public Health England at their Porton Down Science campus. We have capacity for 3,500 of these tests a week, enough for population sampling to begin with. Robust population surveillance programs are essential to understanding the rate of infection and how the virus is spreading across the country. We'll use these tests to help us strengthen our scientific understanding and inform us on the big choices that we have to make about social distancing and how we exit from this crisis. We did not start this crisis with a large diagnostics industry, but that doesn't mean that we can't build one. Just as our top-end manufacturers have joined up the national effort to build ventilators, so the pharmaceutical companies will do the same for testing. Our pharmaceutical giants like AstraZeneca and GSK which have no great history in diagnostics, are now working with our world-leading but small diagnostics companies to build a British diagnostics industry at scale. The new national effort for testing will ensure that we can get tests for everyone who needs them. And I'm delighted that the pharmaceutical industry is rising to this challenge and putting unprecedented resources into testing. Taken together, I am now setting the goal of 100,000 tests per day by the end of this month. That is the goal, and I am determined that we will get there. And to help drive this work forward, I'm pleased that Professor John Newton from Public Health England will be taking on a new role to coordinate this national effort for testing, working with my brilliant departmental officials, the NHS, and the life sciences industry. Professor Newton is widely recognised as a leading voice on public health and epidemiology, and I'm thrilled that we can bring to bear his considerable experience on this vital issue. My 5 pillars represent a comprehensive plan to put in place the testing that is mission critical as we fight this battle against coronavirus. There will be problems, like many of those that we've already overcome. After all, building a brand new industry, it's not easy. There will be bumps in the road and criticisms made, and some of them will be justified. And I return from illness more determined than ever to fight this disease. We'll bring together the best minds, we'll bring together the best science that this country has to offer, and we'll work with our friends and allies from around the world as we do so, because we are in the midst of a war against an invisible enemy, and it is a war in which all of humanity is on the same side. And history has shown that when the world unites against a common foe, then we will prevail. As the Prime Minister said yesterday, mass testing is how we unlock the coronavirus puzzle and defeat it in the end. But in the meantime, while the disease is still spreading and the government builds up its ability to test at mass scale, the most important thing for people to do is to stay at home, to protect the NHS, and to save lives.